Today's adolescents have an alarming rate of suicidal ideation. And what we see in many states and even on a federal level is an increase in funding, an increase in services. But the problem doesn't get better. Our kids aren't getting better, they're actually getting progressively worse. What is going on? Today, I'm going to show you a new bill and connect some of the dots on this issue and show you exactly why these problems are not working. And in fact, they are creating a crisis. Hey, everybody, I'm Julie Barrett, founder of Conservative Ladies of America and Conservative Ladies of Washington, and I am back with another bill of the day. Today, we are talking about Senate Bill 5762. This bill was just dropped yesterday by Senators Orr, Wall, and Dingra, and this bill would be an expansion to the funding of Washington State's 988 crisis line. I personally have a lot of experience with the 988 line in my own family in Washington state. And so when I saw this bill on the list of new bills that had dropped, this one really piqued my interest and I started diving in. And of course, as per usual, I started connecting the dots between this bill and, well, a number of bills this session, but also past bills. So today I'm going to tell you a little bit about the new bill 5762 and also connect some dots for you, help you understand how all of this works together in a coordinated effort. Senate Bill 5762 states that the legislature finds that the state has made significant progress in establishing and implementing the 988 Suicide and Crisis Lifeline, creating greater access to crisis services for individuals and their families in need. The legislature further finds that an improved crisis response system reduces reliance on emergency room services and the use of law enforcement response to behavioral health crises and helps to stabilize individuals in the community whenever possible. To accomplish effective crisis response and suicide prevention, Washington State must continue its integrated approach to address mental health and substance use disorder and continue its progress toward implementing the 988 suicide and crisis lifelines and crisis systems in the country. The legislature finds it is critical to provide funding to enable greater access to crisis care services and supports. Now, this is a 4-page bill, and I don't find anywhere in the text of the bill any kind of reporting on the data and statistics and success of the current program. So let's rewind just a little bit. Back in 2021, the legislature passed House Bill 1477 to create the 988 Suicide and Crisis Line. The bill, interestingly, because I usually see it the opposite way, but it passed through the Senate on bipartisan lines. All the Republicans voted no, and all the Democrats voted yes. But over on the House side, it got a lot of bipartisan support. So it got a lot of support from Republicans. And some of the Republicans that voted yes on this, particularly my friend Representative Brad Clippert, former representative, voted yes on this bill. And I actually had a conversation with Brad, I don't know, a year or two after this bill passed, because I wasn't yet involved in legislation during the 2021 session. And I recall him saying that he thought at the time, because he is a sheriff's deputy in Benton County, and so he, as a law enforcement officer, saw this as being a good tool for people. And this is often the case with a lot of these bills like this one, is that legislators see it as something that will be good for the citizens, but it's actually used in a bad way by the Democrats. And when they actually put it into practice, it's not used in the way that the legislators thought. So as I said in a previous video, the road to hell is paved with good intentions. And while legislators might vote on some of these policies thinking that they're doing good for the citizens, it's really important to view these policies through the lens of, what are the Democrats going to do with this? How are they going to use this policy to advance their radical left Marxist communist agenda? Because that's almost always the case with every single bill. So that's the lens that I look at these through. Now, I mentioned that I have personal experience with this. So I have all my kids are adults now or over the age of 18, which doesn't really seem like an adult because they still need a lot of parenting, but they are all legal adults. And so back when we were living in Washington and when we got married in 2019, we had 4 teenagers still in the house, 3 of them mine, 1 of them my husband's. And in the high schools, they teach the students about the 988 crisis line. It is put into the schools, into the curriculum. I don't know exactly which class it's told in, but they do share this information with the students and that they can access this crisis line if they need support, if they're feeling suicidal, if they're having some kind of a mental health crisis. And now, if this was just part of a mental health, just sort of a health and wellness kind of thing in the schools, it wouldn't really be so problematic. But we're talking about Washington, where they have passed many policies that allow children to make decisions for themselves if they're over the age of 13. And this is the case with mental and behavioral health care. And so they don't need parent permission. They don't need parent notification if it is for anything gender related. And so it shouldn't be a surprise to you that in this 988 line, there is specialized support. You can push the number 3 and be connected to the Trevor Project. Now, if you're unfamiliar with the Trevor Project is a huge LGBTQ organization. They are partnered up with all of the education industrial complex organizations where they provide a lot of the LGBTQ content, surveys, that sort of thing, the supports that go into the schools. They're a very radical left organization and obviously influencing children towards the gender ideology and the LGBTQ spectrum of some sort. And so this isn't necessarily something that you would want your child in crisis calling. These aren't the people that you want your child turning to because they're going to give your child a bunch of resources that do not include you, the parent. And these people are indoctrinating the kids. They are very anti-family. They want to teach your kids that if the parents don't accept them, they will get them a new family. They actually have connections where they will connect these kids to new family that supports them and will accept them with whatever it is that they're choosing. Well, we all know that kids in their teenage years often, very fickle and going whichever way the wind blows, or they might be rebellious. And so they're looking for something like that, something to latch onto and be part of. This is a very dangerous component to this 988 line. Now, in 2023, Washington State passed Senate Bill 5599, which allows children to access so-called gender affirming care and any kind of, trans services without parental notification and without parental consent. And what the state will do is they will actually hide the child in a shelter or a host home without the parent knowing where the child is. So let me play this out for you because, as I said, I have experience with this. My children have called the 988 line. When a child calls the 988 line, they ask them a series of questions, and then the medics come and they pick up the child. The child, at least in our case, the child would sneak out of the house to get into the ambulance. And then the sheriff or somebody with the fire department would knock on the front door and just say, "Hey, I just wanted to let you know that we have your child so-and-so with us. We are taking them to the emergency room and someone there will probably contact you." Now, the first time this happened to me, I was shocked and furious and didn't understand how they could just take my child without me having anything to say about it. But that's Washington state law. And so that's what they can do. So then the next time they came to my house, I just said, "Okay, I'll see you later," because you can't do anything. You are literally helpless. You cannot do anything. And then you may or may not hear from the hospital. Really all depends on the child and if the child allows them to share with you. So we're sharing this in the schools. We are influencing children with gender ideology and connecting them to the Trevor Project. We're telling them that they can call 988 and they will, get their resources. And then the other piece here is that the state pays for the ambulance, which in our case, I appreciated that because I had no control over it. So fortunately, the taxpayers were funding it because otherwise it would be thousands of dollars. There is another bill that was also introduced yesterday, Senate Bill 5764, that would repeal the expiration date for the ambulance transport fund. So they're going to continue paying for ambulance for Washington citizens. Interesting that these two bills are coming through at the very same time. I guess I'm of the mindset that if you're going to allow children to call the 988 line and parents don't have anything to say about it, then the state really should be paying for that ambulance. But again, this is all taxpayer funding, so it's not like Bob Ferguson is writing a check for the ambulance. It's you, the taxpayer. What this bill is going to do is it's a tax increase to continue the funding of the 988 line. And they're not just keeping the funding at the same level, they are increasing it in whole. It's going to be a total of a 233.33% increase over the next few years from the original rate. The original tax is imposed on radio access lines with rates increasing over time. So in 2021, it was 24 cents. In 2023 to June 30th of 2026, it's 40 cents. Then it jumps to 60 cents from July 1st, 2026 to June 30th, 2027. Then finally jumping to 80 cents starting on July 1st. So what they're going to do is they'll come back sometime between now and the 2027 session, and they will make sure to continue funding this beyond 2027 with whatever the appropriate rate would be at that time. Now, like I said, there are no data points for how the 988 line is working. How I'd be curious to know how many of those people are under 18 that are calling it, and where are they going? Are they going to the emergency room? And then how many of those kids that are calling this are then going to a mental hospital? So that's typically what happens. If you have a kiddo who's got suicidal ideation, they will be taken to the local emergency room. They'll be evaluated in the emergency room, and then usually they will get taken to a mental hospital. So on the west side, it's usually Mary Bridge, could be Seattle Children's Hospital. Up north, it's going to be Smoky Point. None of these are any places that you want your children to be. This is a really bad system for your kids to get into. Most of the social workers and people that are in these systems are woke, and they're going to influence your children in ways that they should not be influencing. You're not going to have a social worker, at least based on my experience, and I have experience at all three of those hospitals I just named off. The social worker is going to encourage your child to make decisions on their own without your input. And my daughters, who are now over 18, both look back and say, I wish that they had just called my mom and let my mom make the decision because I wasn't ready to do that. So we do not have, I mean, I'm sure there's some good people in these systems that do care about kids and want children and families to be connected, but you have a lot of activists in this system. And so it's important for parents to know that. Really important to talk to your children before you find yourself in one of these crises. So as I mentioned when I opened the video, we have a huge alarming rate of youth mental health problems. And during COVID, it was like, okay, maybe all the kids are really struggling with mental health because of COVID, and it's going to get better now that, we're going back to normal life. But what we're seeing is the kids were in crisis during COVID. And so that was used as an excuse to really ramp up the mental and behavioral health supports in the education system and beyond. And what this has done is it has actually made the crisis much, much worse. They're actually making kids depressed. They're making them anxious. They're, putting so much on these kids. It's not just math, reading, science. They are having to deal with what gender do you want to be? What's your sexuality? All these different things. And, of course, you've got throw in the critical race theory element and the DEI stuff that they're throwing at these kids. And you have kids that are feeling guilty about their race or their family of origin, or all these things that are completely out of their control. Add on top of that social media, which is a factor that probably most of us didn't have to deal with when we were teenagers, and our kids do. And that's a whole different kind of world that we never had to experience. So they've got a lot of stresses and things on them that the implementation of these mental and behavioral supports are actually making things worse. And I believe that that is all by design. I believe that is the plan. So, as far as Senate Bill 5762 goes, this bill, as I mentioned, was just dropped yesterday. It's already been sent to the Ways and Means Committee. So, that's the financial committee it needs to pass out of before session cutoff. To continue moving on through this legislative session. So, based on that, I would anticipate that it is going to be scheduled for a public hearing either later this week or early next week, so that they can get that a public hearing, and then it would go to executive session where they would vote to pass it out of committee, and then it would go to a vote of the full Senate, and then it would move on over to the House. While it may not seem like a big deal, what's a big deal? More 988 line funding, that probably is going to help somebody. It is all part of a larger agenda. It's more funding from the citizens when Washington is facing a huge deficit, somewhere between 10 and $16 billion of deficit. Is this really the right place to put more money? And is this really a resource that is helping Washington residents? And that is where the data would come in, and it would be nice to see that. So our team will be watching to see if there's any data that is offered up to support the need for this additional funding of this bill, and we'll be sure to share that out. If you're not already subscribed to our Substack, that is the best way to get breaking alerts and calls to action. I will have a link for that below in the description of the video, as well as links to all of these bills so that you can dig in for yourself and track them and follow them as they move forward. So make sure that you've got your notifications turned on and that you are subscribed to the channel so that you don't miss any time-sensitive videos. Thanks for watching. Please don't forget to share this video with your friends, and I look forward to seeing you in the next video.